Hello, my lovely viewers. You are welcome to Claribel Health Hub. Today, we will be discussing specific issues relating to behavior. And we have with us Ms. Jennifer Boateng, a senior pharmacist with a number of years of experience. She'll be discussing with us precisely drug use, misuse, alcohol consumption, and how much they can affect us in health during pregnancy and after pregnancy. As well, discussing some factors or some characteristics we can change to ensure we have a better outcome during and after labor. My lovely viewer, do well to subscribe to the channel. Hit the notification button so that you'll be notified as soon as we release our new video. Health is life. And as much as you want, you can do more in health. Achieving your aspirations, your dreams, and your aims all takes place in life. We make a lot of wealth whilst alive. When we die, all is gone. We want to have the maximum impact with our health, having a good health throughout life and all the time in life. Don't forget also to send us your comments and your questions. We will surely give you a response as soon as you receive them. You are welcome, Ms. Boateng, to our show.
Thank you very much, Madam Clarice. I'm happy to be on your show.
How does drugs, including the use and misuse, alcohol use, and recreational drugs, affect us during pregnancy?
Thank you for the question. Almost every pregnant woman will face a decision about taking medication before and during pregnancy. But then we don't know much about the effects of medicines on pregnancy, simply because pregnant women are often not included in studies that determine the safety of new medications during clinical trials. Because you agree with me that it will be very difficult for you to own up when you are pregnant that use me for a clinical trial for a new drug that is coming up. Let's see whether it will affect my baby or it will affect me.
Africans, we don't take such risks.
No. So it is very difficult to add pregnant women during clinical trials to determine the safety of new medication. So we don't know much about the effect of a lot of medication on pregnancy. Yeah. I want to share with you something that happened around the 1960s. There's a medicine called thalidomide. It was a wonder drug at that time for pregnant women. It was used to treat nausea and vomiting, especially in the first trimester. That you and I know that a lot of women go through that. And it was doing magic for them. And so a lot of pregnant women were taking that medication. In 1961, that medicine was taken out of the market.
Why?
It was realized that that medicine led to about the death of 2,000 children.
Such a helpful drug, yes, which was helping mothers not to have a lot of the vomiting they will experience in the first 3 months of their pregnancy. That was quite bothersome.
And apart from that, it caused defects in more than 10,000 children. So 2,000 children dying, experts say, and more than 10,000 of the children having birth defects.
Oh, that's unfortunate.
And so this medicine, that was a wonder drug, was taken out of the market. And that was when studies into the safety of medicine started.
Oh, so it's important that from time to time we know the safety of the drugs we are taking. Exactly. Could it also mean that not all drugs are safe for us?
I will say that the safety of the medication depends on the individual. The clinical trial may prove that the drug is safe, but based on your condition as an individual, it may not be safe for you. Okay. And then, because we also don't have a lot of women being added to the sample that we use for clinical trials, I've already mentioned that we know little about the effect of these medicines on pregnant women. But then the safety trial is done on animals. So of course you can use pregnant animals to determine whether after the medicine is able to cure a condition, you study the animal for some time to see whether there will be some toxic effects afterwards.
Okay.
Yeah. Medicines that are taken before or during pregnancy can be either over-the-counter medicines, it can be prescription drugs, it can be supplements or vitamins, and it can even be herbal medicines.
Do they help us at all?
I will once again say it depends, because there are certain medications. Sometimes it will be harmful to stop a medication you are already taking before you got pregnant than it will be harmful to stop it than to continue to take it.
My lovely viewers, for us, it will be important to halt some medications we are taking, whether it's prescribed by ourselves as an over-the-counter drug or for recreation. Let's take note of this. Yes.
Okay, so some medications still needs to be taken when you are pregnant. For example, if you have somebody with epilepsy and is taking anti-epileptic medication and the person gets pregnant, you cannot let the person stop taking the medication.
Oh, okay.
For example, if you have somebody with hypertension and is on antihypertensives, you cannot say that because the person is pregnant, we are leaving the person. The hypertension alone can affect the pregnancy negatively.
That's true.
Yes. So there are certain conditions that the medications that you are taking before you got pregnant, you don't need to stop them. At the same time, there are certain medications that you will need to stop them once you get pregnant. So we weigh the risk to benefit ratio.
And these decisions, do I make it by myself as an individual on the drug? Or I need to have some consultation with a pharmacist, with a doctor, with the midwife, or what?
Thank you very much. The effect of the medicines we take depends on certain factors. Number one, the dosage, the amount you are taking in.
Okay.
Will determine the adverse effect or the toxic effect that will come from that medication. It also depends on the stage of the pregnancy. Some medications you cannot take it maybe the first 3 months, but you are good to go the second or the third trimester. And also there are certain conditions that will not permit you to take certain medicines even though you may need to take it during pregnancy. Some pregnant women are G6PD deficient.
Glucose 6-phosphate deficiency.
Yes. And there's a very important medicine that we take during pregnancy to protect ourselves from getting malaria.
Yes.
And this group of people with the G6PD deficiency are not able to take this anti-malaria prophylactic medicine.
My viewers, this is a good information to us. There are some individuals who are not supposed to take a particular type of malaria. Interestingly, in a part of the world, malaria is an endemic condition. So, all pregnant women are given a package of anti-malarial to help them go through pregnancy without malaria or a severe form of any type of malaria. Yes, Auntie Jennifer.
To add to the factors that determine what the medicine will have on your health, we also have drug-drug interactions.
Drug-to-drug interactions.
So if you are taking a certain medication and your health provider doesn't know about it, and he or she also prescribe another medication, and it happens that those two medications interact and you go take it, the consequences of the interaction, you will have to suffer.
But these drugs sometimes are prescribed for us.
Exactly. These drugs are sometimes prescribed for us. And so you ask a question that how do we then solve this problem?
Exactly.
It is very, very important that once we make a decision that we want to get pregnant, we have to speak to our healthcare providers. Most especially, let them know the current medication we are taking, if we are taking any of such.
Thank you.
And once we start that discussion, then we'll be able to determine which of the medication you will need to continue, which of them you need to stop, what we need to add, at what time of the pregnancy. Even before you conceive, there's a medication that you need to start taking. Once you get to the childbearing age, there's a medicine that you even need to take. Because sometimes we get to know, we get pregnant before we get to know we are pregnant.
In fact, the data says that out of 10 women, 4 will come not knowing that they are pregnant, and they have not really planned for this pregnancy. That is what the data say. And this data involves the whole of the world. And in a part of the world, we know that pregnancy planning is usually not part of it. But preconception care brings us to that point that we need to care for ourselves before getting pregnant.
Auntie Clarice, do you know that some of these medications have their negative effect very early in the pregnancy stages? Sometimes the first week, the first month, whatever thing that medicine can cause will cause it before you even get to know that you are pregnant. And so it is very, very important that we start discussions with our healthcare providers once we decide we want to get pregnant and during pregnancy. Yeah.
Beautiful.
Lastly, I want to say that do not start any medicine or stop a current medicine without talking to a healthcare provider. I'll repeat that. Do not start any new medicine or stop current medicine without talking to your healthcare provider.
That taking drugs at any time is not a problem. And then if I'm coming to a pharmacy or a drugstore to get a drug, no, why do you know whether I'm pregnant or not? What do you need that information for?
Now, in the pharmacy, when one walks in to get medicine, the pharmacist will interview the client and try to find out why you want to take the medication. And we do this because we want to give you the appropriate medication. We will not end up giving you something that will not be safe for your use. And so sometimes if you are a woman and especially you request for a medication that can affect pregnancy, we can simply ask you, are you pregnant? But some people get offended that statement, especially when they think, I'm not married. Why are you asking, why? What do you think about me? And sometimes too, the mothers are like, my child is too young. Why should I get pregnant again? So people take offense when you ask them, are you pregnant? Especially when you want to give a medication that affects pregnancy. And so we ask all these things so that at the end of the day, we will give you the appropriate medication that will not be harmful to the unborn baby.
With men, does their drug use affect the pregnancy in any way?
Some of the drugs, yes, I will say it can, because some of the drugs can even affect the potency of the man.
Hello!
Some side effects of certain medication, yes. And so if a man becomes impotent, some medication can reduce your sperm count and all of that.
And your sexual drive.
Exactly. And so once you take such medication, it will be difficult for you to impregnate a woman. Yeah.
So, men, your drug use and misuse can also affect your sperm production. And I know how much men appreciate the ability to have the drive and to make a woman pregnant. Let's all be cautious about these practices. Are there any other things we can do, any other practice we can do to help us save ourselves from these kind of challenges, like having a drug you are on which will have effect on you in pregnancy? What can we do?
Thank you. So if you have been prescribed a medication, maybe your healthcare provider considered your state, being pregnant and everything, and was comfortable that the medicine that he's going to give you will be safe for you. I want to say that we are all not the same. You find some 1 out of 10 giving some negative reaction to the medicine you don't expect that everybody will react to. Don't keep quiet and sit on it. Immediately report to your healthcare provider. Food and Drug Administration, they also have a website you can report adverse effects.
Oh, okay.
Yes, and immediately, if you don't have access to that, go back to whoever gave you the medication or any healthcare provider who is really available and report. Sometimes you may need to immediately stop the medicine. Sometimes the dose may have to be reduced, or sometimes the negative effect may not be that severe or fatal, and so something else may be added to it to make you comfortable. And so you don't sit and say that, oh, they said this medicine will be fine for me, so whether I'm experiencing any bad effects or not, I'll continue to take it. Before you know, it will be causing something fatal in your body. Thank you.
Thank you very much, Auntie Jennifer. My viewers, we have hosted today Miss Jennifer Boateng, a senior pharmacist with a lot of years of experience in practice in a hospital setting and in community care as well. Let us take her advice as much as important to each and every one of us. And let's note this. She mentioned some benefits of having preconception care so that we don't get ourselves misusing or abusing drugs that we are on, whether they were prescribed for us or we just decide to go for them, for we think these things help us cope with life better. Let's be warned. A healthier mother, a healthier father, a healthier family, and a healthier population, and Ghana will get better. It's been nice having you on the show. Please don't forget to send us your questions. Hit on the prescription button, hit on the notification bell as well, so you'll be notified of our new videos as and when we release them. Thank you.